Hi, I'm Sue, and I'm a physical therapist assistant at Mangiarelli Rehabilitation, and I'm also a certified lymphedema therapist. And October is Breast Cancer Awareness Month, and so I thought I would talk to you a little bit about some gentle exercises that you can do after a mastectomy and or an axillary lymph node dissection. Of course, you should check with your doctor to make sure if he has any restrictions or a protocol for you, but these are very gentle exercises that you should be able to do as soon as 2 to 3 days after your surgery. And we want to do these exercises to help with the swelling that you may have. So I'm going to show you some gentle exercises that you can do which will help with the swelling, the post-surgical swelling. They'll help facilitate healing of the incision, and they will also help improve your shoulder function, so your shoulder moves better for you. So the first thing I want to talk about is breathing. So breathing is a very important component of lymphatic movement, so movement of the fluid in your tissues. So you're going to have some extra fluid because it's part of the natural healing process. And so one of the things you can do to help move the fluid out of there is just a simple breathing technique. So I like to do this one laying down, so I'm going to lay down. And you want to take a breath in for the count of 8, and you want to allow your belly to rise as you breathe in and then fall as you breathe out. So it's kind of like the way babies breathe. So you want to breathe in. And breathe out. So inhale, belly up, exhale, belly down, and try to do it as slowly as possible. And you want to do anywhere from 10 to 30 of those. So that's the first exercise. Second exercise that you can do is going to help with your scapular mobility, and your scapula is part of your shoulder girdle, which will help with the function of your shoulder. So you want to start to do some shoulder circles, right? So you want to bring your shoulders forward. That's protraction. You want to bring them up. That's elevation. You want to bring them back. That's retraction. And you want to bring them down. We're going to do those circles. You can do them moving in that direction, and then you can also reverse them and come forward. And now you can do, I like to do 3 sets of 10. So if you want to do, let's say 15 going backwards and 15 going forwards, that would be a total of 30. And you can do that a couple times a day. Always when you're doing any of these exercises that I'm talking about, you want to feel maybe a gentle stretch in the tissues. But if you feel any pulling on the incision itself or pain, you stop. Don't go any further into the motion. Next set of exercises I want to show you are for your shoulder range of motion. I want you to perform them always in a pain-free range of motion. So if you have a gentle stretching in the tissues is fine, but if you have any pulling or pain along your incision, don't go into that, back off of that, or stop if it's too painful. If you're sent home with a drain after your surgery, you do have some restrictions, and that is that you can only lift your arms to 90 degrees this way and 90 degrees that way. So you'll modify these exercises in that way. If you do not have a drain, you don't have restrictions other than the ones that I said, which is if you have any kind of pulling along the incision, don't push into that. Go to where you feel that and then come back down. And pain, of course, stop. So you're going to lay on your back. Normally when I have people lay on their back to exercise, I have them bend their knees. But for this one, because we want to lengthen those tissues, I'm going to have you keep your legs straight. So if it does bother your back when you do this, if you have back issues, just bend your knees. But we'll start with knees straight. So the first exercise is going to be flexion, and you're going to go to here if you have a drain or if you have pulling or pain, and then you're going to come back down here. You're going to do 3 sets of 10 of these. If you have no drain and you have no pain in your incision or pulling in your incision, you can go back as far as you can comfortably. There's no restriction. So once again, 3 sets of 10. The next exercise is you're going to take your hand and put it like this hand is going to go upside down. We're assuming that your surgery was on the left here. And you're going to raise your arm out to the side. 90 degrees is straight out. That's what you're going to do if you have a drain. And if you have no drain and no pulling or pain, you can go up as far as you can comfortably. And you're going to do 3 sets of 10 of those. And then the last exercise, we don't need stick for. The stick helps your good arm, your good side, to help lift up that side that's affected, because it's going to be tender and sore. And the last exercise is like a snow angel, so it's just like it sounds. You're going to take your arms out just like you're making a snow angel. And if you have a drain, of course, you're going to stop there. But if you don't, you can go up as far as you can and down. Try to keep your arms as close to the table or the floor as you, or the bed as you can. And you're going to do 3 sets of 10 of those. That's going to help stretch all these tissues around your shoulder. I touched the microphone again. So these exercises are going to help make sure that your shoulder doesn't get stiff, because you're going to have the tendency to want to protect it because of your incisions, and it's safe and it's okay to move your arm, and it's going to make your shoulder feel a lot better if you keep it moving with these gentle exercises. If you have any questions or you're interested in getting therapy after a mastectomy or an axillary node dissection, give us a call here at Mangiarelli and we'll help you. Thanks.